Good morning. So today I woke up a little later than I wanted to. However, we're going to get this day started. It's a beautiful day, so let's get it. Let's go. Let's go.
I just leveled up, I thank God. Straight from the mud, now it's time to get the pie. Sweat, tears, and blood, you can see it in my eyes. My future's turning up, what it's time to be alive. I'm that nigga, I don't mean to brag, but I'm getting too nice with this. Ain't no way to
Hello friends, it's your girl V, and this is WhereisVeeTV. Okay, on today's topic, we're going to be discussing a day in the life of a clinic nurse. I know I haven't done a lot of these videos, but today I just want to give you a little insight into who is V. Okay, so let's start from the beginning. I have been a registered nurse for over 10 years as of right now. I began as an LPN and worked my way up, went back to school, got my associates, my bachelor's, and now if you've been watching my videos, I have my master's. I'm currently thinking about returning to school to get my NP. I started off as an emergency room nurse, and now I currently work in a clinic. So now I am a clinic nurse. Yay! So there is no more like back-breaking stress for me. Working in ER was very, very stressful. Now if you want me to do a video discussing the life of a ER nurse and everything that I had to go to become an ER nurse, then make sure you let me know down in the comments, because this video is going to be specifically talking about my day-to-day life as a clinic nurse. Okay, so let's jump right in it. From the time I wake up, I have to be at work at 7 a.m. So from the time I wake up, and I live like almost an hour from my job. So that's the worst part for me. Everything else, I feel like my job is easy breezy compared to what I was doing before. Now, I will say this. Nursing is not for everyone, regardless of the type of nurse that you want to be. But the beautiful thing is, with nursing, you can always change and evolve how you want your career to flow. All right, so let's jump right in. What is the road of a clinic nurse? You're going to see me with my phone because I have taken a few notes just so I can stay on topic, because sometimes I do like to go off on a tangent. So what is the role of a clinic nurse? For the clinic that I am, I currently do vaccines in a primary care clinic. So I assess the patient. This is mainly what most nurses do in the clinic. They're usually the first point of contact for the patient after they get through registration. You assess the patient, number one, assess the patient, document the patient if they need any updates, if they need prescription refills, anything like that, and you give the message to their provider and let them know what the patient is asking for. So for me, if the patient comes in for a certain vaccine and say the order isn't in, I will contact the provider, let them know, hey, I need this order, and then we can take care of the patient. One of the biggest things we do in the clinic is patient education. Education. Regardless of what type of nursing you do, whatever profession you're in, you're going to do a lot of education, patient education. So one of the main things, people come in, they don't know why they're receiving something, what something is for. Once we explain to them why the doctor is prescribing or it's giving them certain medication or giving them certain vaccines or ordering certain procedures, then we also provide a printed out information sheet for the patients, and also let them know that they do need to follow up their provider, because we don't give any kind of medical advice per se. Everything has to come from the provider. We can just follow up and back up what the provider has said. So if they have any questions, then it's best for them to go to their primary care provider and get those questions answered. I feel that clinic nurses are like the first line of defense. Clinic nurses have a very important role when it comes to promoting health and wellness within the community and just for human well-being. Like, we are the first people that people come in contact with. So if they've heard something on the radio, if they heard something on TV, if they read something on a blog, if they saw something on Facebook, on YouTube, we are the first person they're going to ask, hey, so I saw this, I read this, so what's going on with this illness? When are they giving out new shots? What's going on with the new vaccines? All of that, we get all of those questions, and we are the ones to answer, like if something needs to be taken seriously, or if it's just the blog talking, because honestly we really don't know anything until like the CDC lays it out for it, then we can give the appropriate information. So based on that, I feel like we have a duty to inform and educate our patients on, don't always listen to everything you hear. It's always best to research and gain your own personal knowledge. And if you still don't know, then you come and talk to your provider. One of the things I like to stress when it comes to being a healthcare provider, this goes for doctors, nurses, techs, anyone that has to work, pretty much anyone that has to work with the public. I feel like how you communicate to someone and with someone is just as important of the information that you're delivering. I feel like a lot of times we deal with the nurses or doctors who don't have the empathy that's needed in order to express the concern or address an issue that a patient is bringing up. So I feel like empathetic communication is going to be really, really key when you're working with people, especially when you're dealing with your health. If someone comes to me and they've recently had another procedure or is currently in cancer treatment, they're asking me if they should get a vaccine or a medication or something or procedure, I have to be able to communicate effectively and empathetically on why or not I believe, or based on the CDC or their doctor recommendations once looking through their chart, why they should or should not receive certain vaccines. So with that, I'm going to always stress, please be gentle, and not just with how you communicate with your patients, but your fellow co-workers, because some days the jobs can be stressful. Most of the time it's a little more, I won't say laid back, but it's a little more calm. Basically, that means like you know what you're going to get. You know how your day is pretty much going to go. Yes, every day is different. You're not seeing the same patient, but you kind of know, you can predict your schedule, how it's going to look, especially once you look at the day before who's on your patient list. So just be kind to one another and to your patients, and relay information in a way that you would want to receive information. Don't always have an attitude and things of that nature when you're trying to talk to your patients. Also, in my current role, we rotate charge nurse. So if you don't know what the charge nurse is, basically the charge nurse role is to handle the day-to-day operation of the clinic. You're not the manager, you're not the supervisor, you're just in charge of the flow of the clinic for that day or for that week. So when you're the charge nurse, you're going to do, if a patient or a staff have any issues that arise that need immediate attention, you're going to be the person you go to, and you're the one who speaks with the manager or supervisor to make sure every situation is handled. It's mostly a lot of paperwork when you charge. You have to do counts, you have to do spreadsheets, all that, and make sure it gets to the right end of day reports, beginning of the day reports, medicine counts, all that is on the charge nurse. And because I can't really film, I can't film in my clinic because of, privacy, HIPAA reasons. So I can kind of walk you through what my day is like. Like I said, I have to be at work at 7 o'clock in the morning. We sit down, we have morning huddle, which is when all the nurses come together and discuss the patient list for the day, the roles and responsibilities of each nurse for the day. And then once the huddle breaks, it usually lasts about 5-10 minutes. Once we break the huddle, then we go on our day and start planning out our schedule for the day. So once I'm done with huddle, most of the time her first patient comes around 8:30, and then we're just busy from that point on. So you see patient after patient, cleaning as you go, a lot of charting, and at the end of the day you do your count, return all your paperwork into the charge nurse, or make sure you've documented in your medical record, and at the end of the day you get up and go. So one of the main reasons why I love being a clinic nurse is because I don't have to take a lot of stress home with me. Working in the ER, home health, all these other positions that I've held, they were stressful, and I felt like I had to take work home. Especially with home health, I still had to chart once I made it home most of the time. Sometimes patients would call my phone if they have an emergency, and I would have to relay the message to the next nurse or the nurse that's on shift in the morning or whenever. Or if I was out, you still have to stay on top of your paperwork. So with this clinic position, I feel like I don't take my job home with me. Once I clock out, I am off. I get to go home to my family and my baby and just be me, and not have to worry about what I have to do the next day. Okay, one of the main questions that I get as far as being a clinic, how did I become a clinic nurse? How did I become? Basically, with this position, I kind of just apply. I kind of know when it's time for me to go to a new role. If I'm getting too stressed, if I'm not sleeping and stuff at home, like when I was doing for the emergency room, I knew it was time for a change. However, with this position, It was because of the pandemic. That's how I ended up in this position. At the time, I was a flight attendant and I became furloughed, so I was just applying to a variety of positions so I can still have as much money coming in as I did before I was furloughed. And they just called me back to the clinic because at the time, nursing staff was very, very short and they needed someone immediately, and I was a direct hire. I don't think I did a official interview. I came in, did all the paperwork, and they said you got the job. So that is how I became a clinic nurse. Now, I did the process for hiring at my current clinic. It was long. I think it took about a month. So during that time, I was still in training. I was trying to still fly and work in the clinic, so I had to give one up. And for me, after being furloughed, I decided to give up being a flight attendant and just go back to nursing full time, because I was trying to do flight attendant and do home health, but PRN, which is just like part-time or on an as-needed basis. But I needed my funds to stay up, so I just came back to nursing full time, and that's why I'm in this clinic now. That's how I transitioned. So my suggestions to you, if this is something that you want to do, if you're tired, I won't necessarily if you're tired of the bedside. If you're just looking for a change and you want something else to do, then look up different clinic positions, because I'm telling you, they have them everywhere, especially now. Most hospitals, most doctor's office, depend on what you want to do. Find a clinic, and Google is your best friend. Look at the job positions. What I like to do when I'm applying for a position, I like to read the requirements, and then I go back and look at myself and look at my resume, and I determine what previous job experience I've had that would fit, and that's how I write my resume based on that experience, and that's when I submit it. So for instance, for this position, you needed to have experience with the geriatric population. I had that. I've worked in home health. I worked in the ER. So all I did was input that experience as one of my top spots on my resume. I just rewrote it and put that first. So, because 9 times out of 10, when people are looking at your resume, they are looking for keywords and key phrases. So whatever keyword or key phrases that they have in their job description, that is what they want to see on your resume. So I always tailor my resume to meet the job that I want, not my resume just to have in there whatever I've done previously, jobs I've done previously. Not to say I don't add in everything, because you want to show a history, and if you have any blank spots where you didn't work or something, they're going to ask you about that. So I just tailor my resume to fit the wording of the specific job that I'm looking for. Resume tip number 1, just in case you wanted to know. And if you want to know anything else about doing resumes, just hit me up. Also, always email me. My email address, hit me up on social media. Be sure to like, share, and subscribe if you really enjoyed this video, and I will always get you the information that you need. Now, the type of charting. Charting is a very big thing in nursing. So you want to be computer savvy, especially when you're working in clinics, when you're working anywhere in healthcare. You want to be computer savvy, because they're changing the electronic health record operations. They're changing how you chart. They're changing how you do that. They're changing everything. Is becoming electronic. We're doing telehealth visits. You're doing using soft phones, all this kind of stuff. So you want to make sure you're always up on the latest formats of how you're input in electronic health information. Don't get me wrong, they are going to train you, but just have some basic background of how to use a computer. 9 times out of 10, we all do. We use our phone, we use computer, we use iPads, we use all this stuff. So just know you have to be computer savvy when you are applying for these positions. So in closing, I'm just recap what we discussed on a day in the life as a clinic nurse. So number 1, you're dealing with patients all day, right? So you have to be able to communicate effectively to the patients and to the providers. Number 2, you have to be able to adapt to any situation that comes into the clinic. You have to be able to educate your patients and be kind to them. Have an empathetic ear when you're discussing and answering questions that they have for you. And always remember that you can always defer to their provider. If there's something that they're not understanding properly, and you've printed out everything for them, gave them the information sheet, explained it, and they still need a form of clarity, make sure you refer them back to their provider so the doctor can explain it in layman terms for them. Number 3, how do you become a clinic nurse? Like I said, just look on Google, look at a hospital, look at any position that you can find online, visit different hospitals' websites. They usually have a job listing and job postings, and just apply. I will recommend that you kind of tweak your resume to say the keywords and phrases that they're looking for in that particular position in order to make sure that you're kind of high on the list and being chosen for the interview. Number 4, different roles in the clinic. We have some clinics have a dedicated charge nurse. Sometimes charge nurse have they change weekly or daily, or they float. My clinic, we have a weekly charge nurse that we rotate different positions. So you want to be able to talk to leadership, executive leadership, managers, supervisors, your providers. You have to be open to discussing things with the full interdisciplinary team in order to get help and make sure your patient is being taken care of, as well as manage all the paperwork, all the reports that you have to do within the clinic at the beginning of the day, at the end of the day. All right, so lastly, as far as nursing period, nursing is not for everyone. My passion for nursing came from me wanting to take care of my grandmother when I was younger. She instilled that in me. I initially wanted to be a doctor, but that was a whole lot more schooling, and I ended up joining the military. That's a whole different story. So I became a nurse, and I love it because there is so many different things and career paths that you can take with the nursing. So if you're interested or ever thought about being a clinic nurse, I say give it a shot. The beauty of being a nurse, you can always change. It's never too old. You're never too old. It's never too late for you to pick another career path. So with that being said, if I have answered all your questions, or if you have more questions, be sure to drop me a comment down below, and I will be sure to reach out to you to answer your questions. And be sure to like, share, follow, and subscribe. Once again, this is V. Thank you so much for watching. See you next time. Smooches. Hit the notification bell so that you never miss a video from me. See you next time. Mwah.